Hello, everyone. I hope you're doing well. We're about to get started. Welcome to the Medicare One-on-One seminar. This seminar, I may say webinar, is going to teach you everything you need to know about turning 65 and going on Medicare for the first time. And it looks like everyone is getting logged in, so definitely go ahead and make sure you're joining us. I'm going to get started. I do want to make sure that I do touch a few things. So I do want to briefly explain who I am and why you should listen. So again, my name is Kayla Price, and I'm here at Price Services Group. I'm the founder, CEO, owner of this insurance agency, and we are independent. We're located in North Carolina, and we serve clients throughout the country. So whether you're in North Carolina, Florida, Texas, South Carolina, Ohio, Virginia, California, or any of the other states we work in, we certainly can help you. Now, you're going to find that this educational seminar is going to be helpful with the transition to Medicare, and I'm able to help my clients who are seniors with their options when it comes to Medicare. So we're going to go ahead and dive into this information. A little housekeeping. Make sure you have a pen and paper. If you don't have one in front of you, definitely go ahead and grab that. We're going to be going through the A to Z for Medicare, and you'll know what Medicare is and how it works, what your options are, and the parts of the plan. So it could be an alphabet soup, of course, but I want to keep it as simple as possible, and I want to clarify as much as I can for you. So we're building a roadmap. By the end of the webinar, then you'll know exactly what steps you need to take and what order to take those steps to transition to Medicare at age 65 or otherwise. Again, go ahead and grab a pen and paper if you haven't. Grab a cup of coffee, water, whatever you may need. Have a seat, and we'll dive right in. So I'm going to be sharing my screen with you. You should see my presentation. And I'm excited to be here because I do have some bonuses for you all. We'll touch on those briefly during this presentation, but the folks who are able to meet with me will get the benefit of those bonuses. So I definitely would appreciate you sticking in with the entire webinar today. And again, we'll go through those free items at the end and what those are. All right, let's dive in. So original Medicare, that's your Part A, hospital coverage, and your Part B, doctor coverage. Now, Part A has a $0 premium if you have 40 quarters. So that means you work 10 years or more, or your spouse has worked 10 years or more, paid in taxes to cover that. Okay. Now, the hospital coverage is your room and board. So if you're admitted into the hospital, then that's covered under Part A. Again, that's not costing you anything each month. Now, Part B, that's your medical or doctor's coverage. And that pretty much covers everything else. That includes doctor's bills, bills for surgery, from your surgeons, physical therapy, and other services you may receive. In 2023, the Part B premium is $164.90. And that typically does change from one year to the next. So just be aware of that. But we'll definitely keep you updated on that. That's something we do for our clients. So this, again, is what we're calling original Medicare. Your Part A, your Part B. Now, there are a couple of ways to enroll. So first, if you're receiving Social Security benefits, then you're automatically enrolled, and your payments will be taken out of your Social Security check. So 3 months before you turn 65, you should receive a red, white, and blue card, and that that'll show you that you're enrolled starting the first of your birthday month. Again, this is an automatic process. So definitely make sure you're writing this down. If you're receiving your Social Security check, again, this is automatic. $164.90 to $164.90 will be taken out of your check each month. All right. So you may be saying, well, I don't receive Social Security, so what do I do? Well, if you're someone who started working and you decide to delay, started still working and you decide to delay, then let's say, age 68 to 70, well, you'll have a little more work to do. So you'll have to actually manually enroll, and you can do that online. You can do it over the phone, in person, or by mail. Now, I typically tell my clients to do it online. It's the quickest way to do it. And you can actually track it up there as well. And understand that you will be paying quarterly for your coverage. So that'll be $494.70 here in 2023 that you'll be paying each month for your Part B. So again, a little more work if you're not receiving Social Security, but it's not really too hard. And we can actually send that link over to you after our one-on-one call if you do need to enroll. So we can definitely make sure that you have that. All right. And again, you may be asking, well, when does my coverage start? So it's the first day of your birthday month. Unless your birthday is the first of the month, then it will start the first of the prior month. So just be aware of that. And let's say I'll use my birthday. So my birthday is May 15th. Gifts, cards would be great. Just kidding. You don't have to send me anything. I do want to use my birthday as an example. So let's say I'm going to be turning 65 in May of 2023. So my coverage will start May 1st. If my birthday, however, was May 1st instead, then my coverage would start April 1st. Now, if you're one of the 1 in a million with that type of birthday, again, understand it starts the first of the prior month. Now, some people may be working right now, maybe on the employer coverage. You may be wondering, well, what do I do? But we'll touch base on that next. Okay, so for those folks who are working and have employer insurance, so there's two things you can do, so two options. You can enroll in Medicare effective your 65th birth month, or you can decide to delay your Part B and wait until you're retired. So that's certainly an option that you have. And so what that looks like, if you're turning 65, you may decide that Medicare would be a better option than your employer insurance. So you would enroll in your Medicare and then decide on your coverage option. So whether you want a supplement or advantage, again, that would be in comparison to your employer insurance. Some people decide to keep both. So it just depends on the situation and what works for them. Again, you may decide to delay. Now, if you're in a situation where you don't have other insurance coverage and you decide to delay, be aware that there are penalties. And so what my office will do is make sure we cross those T's and dot those I's and make sure we're avoiding any penalties, making sure you're enrolling on time. We definitely don't want you paying something you don't have to. Now here we're looking again at those exposures for original Medicare. So again, Part A, you have a deductible of $1,600 for each stay. Part B, deductible $226 for the calendar year for 2023. Co-insurance of 20% with no limit. You have a Part B excess charge of up to 15% extra. So you may be thinking, what does that mean again? So let's say with Part A, you are admitted into the hospital 3 different times, so 3 stays in the hospital. That's $1,600 for each stay. Now, don't worry about that hole because I will show you how to plug it, but just want you to understand how Part A works. Now, understand that there may be, co-pays, co-insurance, and percentages that may be required out of pocket under original Medicare. Again, we're not getting into the nitty-gritty today. We're trying to keep it simple. And I'm going to show you why none of that really matters, because you're going to make a good decision for the rest of your life and cover those holes in your coverage. I'll show you that in a minute, but I do want to touch on Part B. So again, if you're having surgery or something like that, understand that there is a small deductible. It's almost laughable, $226 for the calendar year. Now, you have those doctor's bills, again, you pay the first $226, but there's a co-insurance of 20% with no limit. So Medicare's paying 80%, you're paying 20%, no limit. So it may not be a big deal with the $200 medical bill, but what if it's $200,000 or more, $100,000 or more, $50,000 or whatever it may be? That's 20% of whatever the bill is, no limit. And let's, dive into one example. So let's say you stay in the hospital for, a couple of weeks and you have a big surgery and you have a $100,000 bill, $100,000. These costs are adding up for these medical services, and you more or less, have to play the cards you're dealt. Now, 20% of $100,000 is $20,000. $20,000. I don't know about you, but I don't want to pay 20 grand, even if it's for a medical procedure. It's still a big hit. So that's why you have people buying Medicare supplements and Medicare Advantage, or Medicare Advantage plans, I should say, or other. You can have a Medicare supplement and a Medicare Advantage. Tip on that: we don't want you getting in any trouble, issues with having those two. So you can have a supplement or the Advantage. Anyway, understand that especially with an Advantage plan, you're looking at a out-of-pocket max that the insurance company is saying you have to pay. Again, these types of plans, so the supplement and Advantage, are helping to plug that 20% of no limit and other costs associated with original Medicare. Now, I do want to touch on, again, the Part B excess charge. So that's, again, up to 15%, excuse me. And that's on top of the agreed upon amount that the doctor still had with Medicare. Again, Medicare doctors and facilities and so on negotiate the cost of certain procedures, and the doctors and facilities agree to take those payments. Well, the tricky thing is the doctors and facilities and such, they may choose to charge up to an additional 15% over that. And that's what your excess charge is. Now, there's a lot of doctors probably don't charge that, but they very well could. And you don't want to be limited, because of that. And so we want to make sure you take care of that exposure as well. So that's why I put that on the list here. Again, Medicare pays 80%, but you're stuck with 20% unless you solve the problem. Now, let's look at Medicare supplements, Medicare Advantage. Now, these are two drastically different ways of plugging the Medicare coverage holes that are under original Medicare. So the first way is a Medicare supplement and getting enrolled into that plan. There are several options. There are a lot of insurance carriers that offer those plans. And the other way is the Medicare Advantage plans. Again, you may have seen those on TV, gotten calls, mailers, and things. But yes, drastically different. Now, I do want to break down the difference between those right now. So I know I do talk a bit quickly. So again, make sure you're taking good notes. If you miss anything or have any questions, we can take care of that during the one-on-one. And we can help you fill those gaps in the presentation during the call. So this is the chart. It shows you original Medicare, so here on the left side, and Medicare Advantage on the right. The first way is your Medicare supplement. And so it works with your original Medicare. And you add on the supplement, and you can add on the Part D prescription drug coverage. That's the first way. The other way is a Medicare Advantage. It steps into place of original Medicare. And the reason I say that is Medicare Advantage plans, so the carriers contract with Medicare to provide the coverage. And so they step in the place of original Medicare to provide Medicare coverage for you. Now, with either of these options, you're no longer dealing with those huge exposures under original Medicare. The private insurance companies controlling what the coverage looks like and the premiums. And you've probably heard a lot of names out there in the market, and we'll look at a list in a few minutes. But these plans are, again, different than the original Medicare and the supplement. And understand that insurance companies, they're getting reimbursed by Medicare to provide the coverage to you. Now, with Part C or Medicare Advantage plans, you're combining hospital. So that's your Part A. So again, right here, combines Part A hospital and Part B doctor coverage into the same plan. And often you have Part D or prescription drug coverage in those plans as well. Again, it's important to understand what is a part of those plans. And what I want to do, because you may be wondering, okay, I see a supplement, I see an advantage. Well, what does it all mean? How does it compare? So this chart will help you with that. So on the left, you see the Medicare supplement. On the right, you see the Medicare Advantage. So with the supplement, the coverage is more robust. You're going to see lower out-of-pocket costs when you actually use the coverage. So when you go to the doctor, you want to pay a little bit. You may pay a little bit, if anything, really out of pocket, depending on which plan you choose. So if you have a Medicare Advantage, it is different from the supplement. Understand that. So with the supplement, your price is going to be your Part B premium. So that is right here, Part B premium plus your supplement. Again, the Part B premium for 2023 is $164.90 a month. And the supplement premium depends on the company you go with and the plan you choose. Again, this is private insurance purchased separately, and it's an additional cost. It can be a little more expensive than Medicare Advantage plans, but this is also the reason why the coverage leaves you paying little, if any, out of pocket for your services, depending on what you're getting done, especially after you have met your deductible. Okay, so understand with networks, so you're able to more or less choose any doctor or facility that's contracted with Medicare, and there's no referrals required. So like something like 97 or 98% of doctors accept Medicare, so it leaves you very wide open. And you don't really have a problem with networks for supplement. Now with prescription drug coverage, so here your Part D, that's a standalone prescription drug coverage. And understand that you don't have to go with the same company for the supplement and the prescription drug coverage. Some people think you have to, but no, you don't. So just understand that. Now, with the Advantage, you may be asking, well, how does that work? Well, you have a higher out-of-pocket cost when seeing a doctor, going to the hospital. A lot of times it's not bad, but it can add up some, especially if you have something like cancer or major heart issue or surgery, that you could, end up spending an out-of-pocket maximum of a few $1,000s. And the plan availability will depend on your zip code. So understand that every plan is not available everywhere. Okay. So just be aware of that. Now, out-of-pocket max, it could be more than $7,000, let's say. But you have to meet that amount before there's 100% coverage. So that could, come into play again with huge issues, like if you have major heart problems or if you have cancer. So is this coverage under the Medicare Advantage less robust than your supplement? On the flip side, the premium is less. Now, again, that's the cheaper option, but is it really? Looking on the face of it, it's cheaper, but when you get into the coverage and what you have to pay, you may end up spending a lot more. And again, networks. So you can choose any doctor that's contracted with a specific company or a specific plan. Understand that every doctor may or may not accept all the plans available in the area. And typically you will need a referral for some of these plans. So just be aware of that as well. And these plans can come with Part D or prescription drug coverage. So that's important to know as well. And you may be wondering, okay, well, I see the pros and cons, I see the differences. Well, what do you think? Well, I'll give you my opinion. So in most parts of the country, it's important to remember the coverage you receive and the ease of use of those services or receiving those services. So that's why I like the supplements, because you don't have to worry about these major medical bills. So whether it's a bill for $100,000 or $6,000 or what have you, paying a little bit more premium, let's say maybe $100 or $200 a month, can save you on the flip side, because you know what the fixed monthly cost is. And even if you go to the doctor and get a $6,000 bill for a procedure, well, I pay my deductible, if there's, depending on the plan, I'll pay my percentage. Beyond that, I don't have to pay this big bill. So there's comfort in that. And I just want you to be in the place to make an informed decision. I'm not saying Medicare Advantage is bad, but there are certain places for it. And we certainly can go through your particular options in your one-on-one and discuss that with you so you know what it looks like. And again, remember your Medicare Advantage, it'll depend on your zip code. And so it can vary from one place to the other. And just, be aware of that. Now, I do want to show you this again. So you have your original Medicare, your Part A, Part B, your supplement, and your prescription drug coverage. The supplement, again, is through private insurance, plugs the holes of original Medicare. They can also be called Medigap. And, those are used interchangeably. So please don't get confused. And also, just be aware again with your Part D, your prescription drug coverage here. That's separate. And we can dive into the specifics on that in your meeting. But just be aware these additional coverages of the supplement in the prescription drug coverage is really just plugging the holes that are there with original Medicare. All right, so again, we have those major exposures. So Part A, again, you have your deductible for hospital stays. Part B, your deductible $226 for the calendar year, co-insurance of 20% and excess charge up 15%. So just remember that. And you may have seen some of this information in your Medicare U-book that you received in the mail if you're watching this, but I do want to touch on that. Now, I do want you to take a look. So these are standard plans available with a lot of carriers. The government requires that the plans be standardized across companies. So the insurance companies that are offering these various plans, they have to be the same as the others as far as the basic coverage benefits here that are listed. So you have A, B, C, D, you have F, G, K, L, M, and N. Okay. So what we're going to touch on is Plan F right here. So Plan F, as you can see, these check marks mean 100% coverage here. It covers a lot if you compare it to what's listed up here. 80% for your foreign travel emergencies. Now, you may have your parents that have this type of plan. A lot of people, call it a full coverage plan. And it plugs those holes, like we mentioned before, like the $1,600 deductible for hospital stays, and also the Part B deductible as well, and the excess charge. And the plan is great. The downside is it's not available to people who are turning 65. So as of 1/1/2020, it was no longer available to people turning 65. So you may be wondering, whoa, what do I look at now? Well, the Plan G, which is right next to it. So here, it covers everything that F covers except for the deductible. Remember, I said the Part B deductible was $226 for the calendar year. So you can still have that robust coverage. You just need to meet the deductible. Let's say, for example, and this will show you why I love Plan G, how robust it is. So again, let's go back to that surgery of $100,000 in the hospital stay. So with the Plan G, you pay $226, which is your deductible. The plan is billed for the rest of it. So you're paying $226 out of $100,000. And of course, this is Medicare approved charges, meaning that the doctor said, yes, it's medically necessary. Now, this isn't saying you can go get a nose job unless it's medically necessary. Then you just pull out your 226. Here you go. Let me get my nose job that is medically necessary. Again, understand this is during the calendar year. So when the calendar year starts over again, you have a new deductible to meet. But I love the Plan G because it has that robust coverage available. Now, the Plan N is also a good plan as well. So here you have the 100% right there. Now, it doesn't cover the deductible, so it's like Plan G in that respect. It also doesn't cover the excess charge. Now, the major difference is that excess charge. So, you may be paying $25 a month less for Plan N versus Plan G. On the flip side, there's a $20 copay for every office visit and up to $50 for emergency room visits. So, you're also still paying that Part B deductible. So with that major difference, you would be responsible for the 15% excess charge if the doctor decides that they're going to charge it. So that's why I'm a fan of Plan G, because you don't have to worry about the excess charge. And that's not as big a concern for you. Again, the Plan F is no longer available, so that's why I would suggest considering that Plan G, because it provides the same robust coverage and it is available to you. Price Services Group has been doing this for years now, and I've been able to help my clients, especially those who have those Plan Gs, and it's very popular with them for the reasons I mentioned. And it's literally you pay the deductible and then the rest of it is taken care of for you, and it's easy to budget for. All right, so you may be trying to figure out, when should I sign up for this supplement? You typically should sign up 6 months before your birthday starts, because that's going to be where you get the best rates for it. And I look at it this way, you're going to have medical bills, but you want it to be more predictable. So having the premium locked in at the lowest rate and knowing, okay, once I pay my deductible with the Plan G, they're paying the rest of the bill for me, it makes things a lot more predictable. So my suggestion would be for the cheapest rates to lock it in 6 months before you turn 65. And that way you're not paying more than you need to at that particular point, because it can increase between that point and when you turn 65. Now, understand if you don't sign up before your open enrollment ends, so that's 6 months after you turn 65 and have your Part B, the premium will increase. But also, if you don't sign up before your open enrollment ends, then you have to go through underwriting, and that would consider your age, smoking, and medical conditions. So you definitely want to try to avoid that if you can by signing up early. I'll advise signing up 6 months before, because it'll be off your list, one less thing to worry about, and it will be your cheapest rate. So that's definitely something that we can help you with. And just to make sure you understand, it doesn't matter which insurance company you're getting it through, your Plan G is going to look the same from one company to the next as far as, what the base coverages are. The main thing is that you're locking in that lowest rate possible 6 months before. And that way, the only thing you have to worry about is, okay, let me make sure the monthly premium is paid. And I know, once I make my deductible, I don't have to worry about it. Now, I mentioned briefly before the plans are standardized. That's because the federal government requires it. And the coverage follows the letter of the plan, not the company. So a plan G is standard from one company to the next. The difference is typically come in what each company charges for the standardized plans. Okay, so just be aware of that. Now, in a minute, we'll talk about companies' pros and cons you may want to consider, but the golden question may be, Kayla, okay, I love the plan G, but what is the supplement going to cost? Well, with your plan G, the average rates can be, $100 to $200 a month, depending on your zip code. It may be more, maybe less, but I want to give you a range of what I've seen for the most part. Again, it can depend on your zip code, what your premium will be, and it can vary from one part of the country to the next. And I know there's hundreds of people watching right now. I can't go through every single zip code. So again, on the one-on-one call, we'll go through your options. And I'm going to kind of spill the beans on this next part, but I don't mind. So one of the bonus items will be what's called the Medicare cost summary. And so that document is going to summarize your options based off of your particular zip code. It'll be specific to you. It'll list the exact monthly amounts you'll need to budget for based off of the plans that you like. And that way, what is expected to be paid each month. Again, you can get that through booking your call. Forgive me for that, spoiling that surprise, but I did want to touch on that. Again, the plan G for most of you will probably be between $100 to $200 a month, and depending on the company and the zip code. Now, my agency is an independent agency. Some people call them like a brokerage, but I like independent agency. And we represent over 20 different companies in most areas. So I don't have a bias from one to the other. And we get paid based off of helping you enroll. So, they're paying us out of their side of things. You're not paying me for this service. You're not going to pay a dime for it. And, we're able to help you day to day with your questions, by first helping you enroll, making sure you're filling out the right forms and paperwork, and having everything checked out. That way you feel comfortable and you're feeling relieved and that you're taking care of something, and you can ignore those television commercials and those random mailers and those random calls you may be receiving. And you'll have someone to ask your questions to who's a real expert, and they can really help you. So here's a list of the companies that we work with. Again, this is not an exhaustive list, but these are some of the more popular companies that we work with. And they all have different customer service that they offer, as well as the price of the premium each month that you would pay for your policy. Now you can see Aetna on this list. You have Mutual of Omaha, and those are typically going to be at the top of the list, and as being more popular. And I'm sure you've heard of them. They've been around for forever, and have A ratings for their customer service, and they've proven to be really good in the market and competitive. And a lot of times you'll see us recommending them because they're at the top of the list. there are also some newer companies, let's say like ACE, who seem to be making a good way in markets. You have like Capital Life as well. And so what happens is, because we have a great relationship, we're able to walk you through the pros and cons. Again, we can do that on the phone call of one company versus another, what coverages will work for you. Now, I do want to get a few things out on the table. Again, if you can't tell, I'm Kayla, and I'm pretty frank with how I talk. And I want to make sure that you're getting the information that nobody is really talking about. And so there are a few myths that I want to touch on. And I want to be clear that my goal is to provide absolute clarity on how Medicare works, and the thousands of people calling you all the time and why they're doing that. And all the mail is stacked on the kitchen counter, and it seems like you're overwhelmed and you don't know who to trust. And you don't know what information is true, what's real. And my goal is to show you inside of where, the clarity is on how this works and why, you're getting so much information right now. So, myth number one, most people are going to believe that, I must have to pay a fee to use a broker or someone local that's an expert, and, have the team to help me, and I have to pay for all that. That's not true. So brokers or independent agents like me, we don't charge fees of any kind. We literally never have you pay us a dime to work with us. And we're able to offer you amazing services like lifetime claims and billing support while you're a client of ours. And so for the rest of your life, you'll have a team that has your back, familiar names and faces that you can talk to about the Medicare stuff. And it doesn't cost you a dime. And you may be sitting there, look, I put myself in your shoes, maybe you, John, or Mary, or Sally, or, whatever your name may be. You may be sitting there thinking, that sounds good, but nobody is going to want to work for free, and there's no such thing as a free lunch. So that leads me to myth number two. Again, we don't charge for those services. So myth number two, the insurance companies must charge, me a higher premium each month. If I go through you, and that may be what you're thinking, maybe I'll get some type of discount going through the insurance company, and that's also false. So the truth is, you're paying exactly the same for your supplement, whether you work with me through this process or whether you go with the insurance company. But again, if you work with me, you're getting a lifetime claims and billing services as well as customer service. And you're paying the same price. You don't have to call that 1-800 number for the insurance company that you choose. And they're actually paying me to help you. So, why not get the more personalized service from us versus having to call the 800 number for an insurance company? And myth number three, so you may ask, so Kayla, if you get paid by the insurance company to help me with this enrollment and take care of me each year, then you must be biased from one company to the next. They must pay you so much more money than other companies. And that must influence your recommendations for your clients. Well, that's actually false. And the reason I work with over 20 companies is because those companies provide good services, and it also gives me the span to help more people. So where one company may not work for one person, there may be another company that works better, and we're able to do that. So unlike some companies that, may just be, working with one insurance company. I'll give you an example, like State Farm agent who's recommending State Farm because they work for State Farm. And a lot of times, you may have Allstates and the Geicos and others that work that way. We don't. We're independent insurance agency. We're able to match you with the company that'll work for you, work well for you. And it's a win-win. You're getting the help and expertise, making sure we are dotting the I's, crossing the T's, and you're getting a lifetime customer service. And then we're being paid by the insurance company, whichever one it may be that you choose. And so I don't have a bias from one or the other. I just want what's best for you. And I'm representing you and not the insurance company. I'm looking at what works best on your behalf. All right, so let's get that out on all that out on the table for you there. I want to make sure you understand that I'm literally here for you to help you. And you may not have had it put so bluntly, but the truth is the truth. And some other insurance companies and insurance agencies, they may not want to say it. There may be agents out there who are like, I don't really want to say that, but here I am saying it. So I don't mind doing that. So again, the truths about using a broker. So again, no fees are charged. The price you pay, the insurance company is the same, with or without the broker. And you have a large number of companies. And so we're not biased. And it's not going to cost you anything to work with us. We get paid from the insurance company that you choose. And I want to make sure that you know that, again, the price is the same regardless of which way you go. And we work with over 20 different companies, and we work in over 10 states. So we're able to help a lot of people understand their options when it comes to the Medicare supplement. And, we're able to look and see what works best for you and show you what that looks like. Now, if you want more information about the other Medicare supplement plans, we can definitely go through those in our one-on-one, but I want to focus on those two viable options. So again, the Plan G and the Plan N. So the Plan G is roughly $100 to $200 a month, and you're paying the Part B deductible $226, and that's for calendar year 2023. The Plan N is about $20 a month cheaper than the Plan G. What you're paying for is your deductible $226, copay for each doctor's visit $20, copay of $50 for the ER if you're not admitted to the hospital after the ER visit, and excess charge of up to 15%. So given the pros and cons of those two, what I'd like you to do now on a piece of paper is to circle which of the two plans you think is a good fit for you. And I'm sure you've been taking a lot of good notes for our conversation later, and I thank you and I appreciate you for doing that. And usually by now you have a good feeling on if you want to go with the Plan G or if you want to go with the Plan N. So go ahead and circle that. And no, we'll go over that over the phone. And we can go into more detail about what those options will look like for you. Now, you know what supplement you want. And let's go to this part here, because again, I want you to have a look at that. So again, you have your original Medicare, Part A, Part B, your Medicare supplement, and then you have your Part D or prescription drug coverage. There is no way that I can make Part D sexy, interesting, great, cute. It is what it is. It's a standalone plan. You're able to get that from the insurance company. Again, doesn't have to be the same as the Medicare supplement. What I can do is try to make it as quick as possible for you and go through it. So here we go. All right. So with your Part D or prescription drug coverage, now let's say you're someone who may have, 15 prescriptions or major things, that you want to discuss on the call. We can definitely do that. But what we're going to do is focus overall. Again, during that call, we can go through prescriptions. That way we know what that prescription drug coverage will look like for you. So here we have the deductible stage. So again, this is what you would pay before coverage kicks in. Some plans may have a deductible, $400 or more. Some have zero. It just depends on the plan that you choose. And once the deductibles is paid, you can then go to the initial coverage stage. Again, I'm not saying that you will, but just be aware that the initial coverage stage will be next. And with this initial coverage stage, you're paying copays when you go to the pharmacy each month or every 3 months, however often you go. And if you're taking a cheap medication at maybe $3, $5, you pay that. But if you're taking a prescription that's, $5,000, you might end up paying several $100s, just depending on how expensive the medication copay is. So then once you get through that, you get to the coverage gap stage. So here you'd be paying about 25% for your prescriptions until you reach $7,400. And then once you get through that stage, you get to catastrophic. So that's the final stage in the 4 stages for prescription drug coverage. With that, you're paying 5% of whatever the drug costs may be for the rest of the year. And a lot of times people don't get there unless they have really expensive prescriptions. And so, just remember, if you don't have those substantially expensive prescriptions, you're less likely to reach those higher stages of prescription drug coverage. All right, so what is our process when it comes to Part D? So what we do is we put your prescriptions into an online calculator. We make sure you choose your pharmacy, and then we can look at the plans that are available in your area, get you enrolled in those plans. And some places have a lot of plans available, some don't, just depends on the zip code. Now, you certainly can change your coverage during the annual enrollment period, which is October 15th through December 7th, if you need to, from one year to the next, and that may depend on, how much your prescriptions are costing you. And that's definitely something we can discuss on an annual basis if that's something you would like to do. Just understand, there's no health questions being asked for that. Well, one main thing we'll do during our meeting is, again, sit down and look at each medication and see what the estimated cost will be based off of, the pharmacy you're choosing and the plans available. So that way you'll have that idea. The Medicare supplement, so let's, again, the Plan G, I just wanted to let you know that most people only change those plans if they qualify based off of good health. because after you have signed up for your open enrollment, after that would be based off of underwriting, so that would be health based. Now there's certain zip codes that I have different arrangements. We can talk about that later more in depth based off your particular situation. But for most people, you're signing up presumably for the rest of your life. And if you end up getting sick, it can be difficult to switch. So that's something, again, to think long term, what coverage you want, and what that'll look like. Now I'm telling you this because I want you to make sure that you're getting coverage that'll last ideally for your lifetime. And so that's why you're making an important decision on your health coverage, not only for 65-year-old you, but 95-year-old you. You want to make sure that you're making that informed decision. All right, so that on the drug side, it's not a big deal because you can reevaluate each year, like you saw during the annual enrollment period. So, that's good that you have that choice if you need to make those changes. You're not required to, but you certainly can. Now, some people may be like, well, Kayla, I'm not taking prescriptions. Why do I need to sign up? Well, you need to sign up. And that's because Medicare will assess a late penalty of 1% each month after you turn 65 that you didn't sign up for drug coverage. Again, that's every month, 1% is charged. So, let's say you wait 10 years, sign up at 75, and you need coverage. Well, that's 1% for every month after your 65th birthday that you could have had coverage but didn't. So to avoid that, we can certainly get you on a cheaper prescription drug plan. That way you're not getting that penalty. So even if you're not taking prescriptions, you do have that in place to make sure you're not paying a penalty. And then, if you end up needing prescriptions, you certainly have some coverage there. So enough of that. I promise you, I try to keep it pretty limited. And so here's an overview. So again, we have your original Medicare. Part A premium is usually $0 for most people if you have your 40 quarters. You have your Part B premium of $164.90. You have your Medicare supplement, Plan G, depending on your zip code. And then prescription drug, again, that coverage depends on your zip code. I've seen, typically ranging $50 to $40, could be more per month for that coverage. So just keep that in mind. Okay. So I hope you do find this information valuable to you. I hope you were able to take great notes. I've received a lot of compliments from this. Our office has received those compliments on the presentation and the service provided. And I really do appreciate it. I see some compliments coming in now, so I do appreciate that. Thank you very much. So I have good news. We've taken care of phase 1, which is your Medicare education. We've gone through this educational seminar today. So woohoo, congrats. And for taking care of that. And I want you to know that I certainly do appreciate you and your time. You can certainly share this with other people. You can send them the link that should be in your search bar of your web browser. If you like, we can also provide that separately as well for you to share. Now, phase 2 is the enrollment advice. So here you schedule your free consultation. We can discuss your particular situation, look at the plan options, and see what works best for you. Now, I did mention previously those bonus items. So the first one will be a personalized Medicare roadmap. So that roadmap will give you step-by-step action to take to make sure you're ready for Medicare enrollment. And then your bonus item 2 is the Medicare summary. So this is the My Medicare cost summary. It'll outline the total monthly cost that you'll have for your coverage. Now, with bonus item 1, again, this will take you step by step, and we'll send that to you after our call. It literally is based off of your specific situation, whether you're working or not, whether you're retired or not, whether you're on Social Security or not, etc. So that is something, we'll get the information for during the call, and then I can send it out to you. And you're probably going to say, okay, I've gotten through step 1. What do I do next? Well, you look at, okay, step 1 being, August 1st, you need to do this. So it'll typically chart you out up to 6 months before enrollment to tell you what you do at each point. And this tells you, what you do August, September, October, and so on, preparing for your enrollment, whatever your month may be, it'll adjust based off of that when you're turning 65. And so again, make sure you schedule your call so you can get that information, because we certainly do want you as our clients to have that benefit. Now, the cost summary, so I've talked about that. This is going to give you something to keep in your file so monthly, this is what I'm paying for my coverage. You see it, you know what it is. It'll break down, 6 items, line items or so of the cost that you're paying each month. This is not just for today, but in the future as well. So you can always glance back at that, know what you're paying and what it's covering. Next is phase 3, so lifetime support. Again, I mentioned free lifetime billing and claim support. So, that way we're making sure you're taking care of on that front. And we're also going to check in on you, send out cards, making sure you have your ID card for your plan. Just keep in touch with you. And then always as well, you can have a free annual review. You don't have to, but certainly if you want to, we can review that for you. All righty, so what you can do now, we're at, again, phase 2 is schedule the free consultation. Again, you should see a golden telephone. It may be below this box where you're watching the webinar. It may be to the side. Click on that to schedule a call. Again, you'll receive your bonus items once you have taken action and scheduled your call, and we meet and discuss your situation. Until then, I want to thank you for your time. I appreciate you for for sitting through this and learning about your Medicare route. Whether you're getting ready to sign up, which most of you probably will be, or if you sign up for maybe Part A, what you need to do next. Regardless of your situation, again, make sure you click on the golden phone, schedule a call, and we can certainly get you taken care of. It's been a pleasure, and I look forward to speaking with you again soon. Please make sure you do that, because we do have limited spots. We have about 40 spots, and it seems like the calendar is already filling up. So take action now. Sign up by clicking on the golden telephone. Thank you so much, and I hope you have a wonderful day.